Hello everyone, I am drberkkkaratas. If you've decided to go for penis enlargement, will it be done using hyaluronic acid injection, which is a filler, or will it be done using your own body fat? Right now, these are the two most commonly used methods. I will explain the differences between them, their advantages and disadvantages. Now, hyaluronic acid is being used a lot in andrology, which is our urology department, especially in sexual health and for the penis. What do we use it for? I explained all of these one by one in the videos. This is what we use for penis enlargement. We use it for premature ejaculation at the tip of the penis. And recently, it is also being used for plaque injections in Peyronie's disease. I'm not using this yet. Right now, I am still using PRP, meaning I am continuing with the treatment for plaques. I think there's a bit more to this. Of course, today's topic is penis enlargement. So how do we perform penis enlargement? Let's say there is the dartos fascia under the skin of the penis. There is the dartos fascia. It's called the dartos fascia. There is the blue fascia here. It surrounds the penis. Look at the fascia between these two at 9 o'clock, meaning the lower part of the penis. On both the right and left sides, neither fat tissue nor filler is actually applied. We inject filler material into this area, and that's how the procedure is done. There aren't many scientific studies comparing hyaluronic acid injection to fat injection. In fact, there is a significant scientific study published in 2013 there. A hyaluronic acid called macrolon, which is the commercial name for hyaluronic acid, was used. Lipofilling has been used here. Lipofilling, meaning fat injection, has been performed. As you can see here, there isn't much difference in thickness. Patients are happy with the thickness, but there are quite low side effects with hyaluronic acid. So, after the procedure, the risk of bleeding is lower, the risk of swelling is lower, there has almost been no infection, no nodules, and other problems haven't occurred, and the return to sexual life is quicker. On the other hand, when fat injection is done, the risk of nodules, infection, and bleeding is a bit higher. Of course, this study is like that. There are also studies like this. So there are studies with no complications at all. But if you ask, not all of the studies are part of that section. In the application of hyaluronic acid, the generally accepted study, especially regarding complications, is mostly in line with my personal experience, but it doesn't align with the other study. During the 6-month follow-up, when it was done on about 230 patients, there were unwanted side effects in 4.3% of them. You could also say complications. It has formed. What happened to the 3 patients? There was a subcutaneous bleeding. This subcutaneous bleeding is already visible in the hierarchy. There's no problem. Here they used an 18G2, which is a slightly larger needle. This has also increased the risk of bleeding. They even realized this during the study and reduced the size of their needles. In fact, they suggested using an even smaller needle. And nodules have formed in 5 patients. What we call a nodule is the lumping we refer to. In one patient, it remained unresolved and they had to take it out. In the other patients, something happened. It got lost from their own hand, and there was an infection. What they said here is, yes, we saw infections, but the patients were diabetic, and they engaged in sexual activity much earlier than we planned. That's why I always tell my patients, please don't rush into having sexual relations. In those who are not married and do not have regular relationships, we refer to it as suspicious sexual activity, and there is definitely a significant 1-month period in terms of infections. Yes, they have provided data on when complications or unwanted events occur in the same study. Infection occurs within the first week, during the first few days, or within 10 days. Look, the infection occurred 40, 50 days later, that is after 2 months in these patients. There are already 15 nodules. It occurs daily. Now, I've created a table from my clinical experiences. I used to perform fat injections, but now I only perform hyaluronic acid injections. I haven't done fat injections in the last 4 years, because in the past I used to perform both fat injections. And now, as someone who no longer does that but only performs hyaluronic acid injections, I haven't been doing fat injections for the purpose of enlargement for the last 4 years. I have my personal experiences here, and there are also scientific data. I just explained the scientific data on hyaluronic acid for that reason. Now, in terms of ease of procedure and application, hyaluronic acid application is very easy. It's a ready-made substance. Penis. It can be done immediately after numbing the penis. The procedure takes about half an hour to 40 minutes. It can even be shorter. And patients can return to their normal lives very quickly. It's not the same with fat. I prefer to do it more in operating room conditions. There is a process of extraction, so there needs to be a process related to its extraction from the body. Of course, this can be done by a plastic surgeon. I was working with plastic surgeons at that time. Plastic surgeons do it, and that's how it gets fattened. After it gets fattened, it is prepared. After it is prepared, it is injected into the subcutaneous area of the penis. Of course, as this process takes longer, the environment needs to be much cleaner. You have to be much more careful, and it takes a bit longer. And afterwards, since it is taken from the abdominal area, what happens to the patients? They have to wear a corset. This becomes a troublesome situation for the summer months. So, in terms of ease of application, hyaluronic acid is much easier to apply. It can be reapplied, and I place a lot of importance on this. Hyaluronic acid is also very easy. So, over time, for example, there can be reductions after a year, or after 2 years or 3 years, you can do the supplements, and you can do it very quickly. Like you can supplement 200 cc of hyaluronic acid in just 10 minutes. Or it's not really possible. So, since it can't be done repeatedly, like every week, once a month, or once a year, hyaluronic acid is very advantageous in this regard. Now we have issues like nodule formation, deformity, and lack of infection. We already have 3 important issues in this matter. In these cases, hyaluronic acid is a step ahead compared to fat tissue. Now, the fat cell we take from ourselves is a living cell. So, the fat cells that are injected, we don't really know how they will behave in that living tissue for most patients. Also, there is no fat tissue under the skin of the penis under normal conditions. So, when we inject fat tissue there, since it's a living cell, unpredictable situations can arise. Of course, because of this, the formation of nodules, which we call lumping, requires more attention to the sterilization of the environment where the procedure is applied. The risk of infection and deformities can be a bit more pronounced with fat. Of course, there is also a risk of infection with ionic acid. If you don't pay attention and don't use the appropriate fillers, it can happen. The increase in thickness and patient satisfaction are almost the same for both sides. On average, you inject between 15 to 20 cc or up to 25 cc of hyaluronic acid. In fat, it can be done with an average of about 30 cc or even more. Here, you can achieve as much thickness increase as you want, but our goal is not to have a penis that looks like a balloon. The aesthetics should be suitable in width and length, especially when it becomes erect, for the appearance to be nice. I mentioned durability a little while ago. So, with hyaluronic acid, durability can be predicted very clearly. In 2 years, it will decrease by 1 centimeter. It will keep decreasing gradually. It will continue to decrease gradually over 1 or 2 years, or we can't really say something like that. Even if we say it, we were embarrassed at the time, because, as I said, since it's a living body, there's no way to know how the body will react to it or how it will progress. There is no clear data. So this could either last for 10 years, or 1 year. Results last 10 years. Unpredictability bothers me. I still have patients whose results have lasted for 10 years. Their thickness has continued. So, honestly, the unpredictability of it has always bothered me. The method of starting a relationship becomes much quicker because the procedure is a bit less invasive. You inject the filler through small channels called tiny cannulas, especially for married couples, or rather those in monogamous relationships. I can usually start them on sexual activity about 10 to 15 days later. Using fat takes a bit longer. Since it will also be used for things like corsets, it takes about 4 weeks. Regarding the price, when I first started with hyaluronic acid injections, the price was really much higher compared to fat. The price was about twice as much. So, if we were doing fat injections for 1 lira, we were doing hyaluronic acid for 2 lira to achieve the same thickness. But because of its advantages, I continued with it. Right now, there's not much of a difference left between them because, as you know, due to the situation in our country, the prices of operating rooms and materials have increased significantly. Again, there are only a doctor performing the procedure and the materials involved. So things are a bit more complicated with fat. The materials used are more, yes, the fat is taken from the patient for free. There's no charge for that, but due to factors like the use of the operating room and the involvement of aesthetic procedures, the costs have become almost the same now. Frankly, I prefer oil and tape, technically. For these reasons, I never think about making oil. But of course, we did fat injections for many years. When compared to hyaluronic acid, it tends to take a back seat, but it's still a very good method. Especially when done well, patients are quite happy. Here, when compared to hyaluronic acid, it tends to take a back seat. It's still a very good method, especially when it is done well, or patients are very happy. If you take precautions against infection, it will be fine. But of course, in practice, I believe that in the future, hyaluronic acid will be used much more widely, and there will be a lot more research done on it all around the world. You can talk to your doctor about what you want and go with whichever option you prefer. Thank you.